Welcome everyone. I'm really excited for this segment of Just Live. Today we have special expert Dr. Jill Foster. She is a professor at the University of Minnesota and a pediatric infectious disease expert. And we are here to talk about COVID-19 and the Delta variant. So I want to jump right in. Our members and viewers have so many questions. It's a confusing time for sure. We've all endured quite the pandemic and now all new questions again, just when we thought we were maybe coming to some type of ending, there's a twist at the end. So starting first with the Delta variant. What is the Delta variant? What's a variant?
Okay, so viruses are really smart. So viruses are always trying to figure out a way to get around anything we can do to try to defeat them. And so the first thing we did, the virus got into the system, that was kind of the alpha virus. And then now the virus, because it's spread from so many people, it's had a chance to get smarter. And so really what Delta is the super smart version of the alpha virus.
Wow. And so that's throwing some of our vaccination efforts in a spin. What is it with the vaccine and Delta that there are people that are vaccinated but still getting COVID? Is that all Delta variant, or is that true of any COVID? What can you tell us about vaccination and the Delta variant?
It's interesting because if you read the paper or consume any other content, it looks like everybody is breaking through. But for Texas, for instance, there's been 9,000 deaths since February, and only 43 of them have been people who've been vaccinated. So I think it really puts it in perspective that it's very few people are dying. And that's because the main thing the vaccine was designed for was to keep people from getting really sick and to keep people from dying. Second part of that is, some people are breaking through. The majority of people who are breaking through, though, are people that are living in houses with a lot of people with COVID. So, picture the house, you go in, you got 4 or 5 people coughing and sneezing and having fevers, and even if you're vaccinated, that's just too much for the vaccine to overcome.
Is the Delta variant more lethal or just more contagious? And should we even care about the difference?
Yeah, I think we should care. It's the way the virus works is it gets in and it attaches to your cells. So the way the Delta is it just like locks right on. Where the other one, it would be sort of, it could sort of attach and it would sort of fall off when you took a deep breath. But the Delta variant, once it gets past your mask into your nose, it just latches right on. And then once it latches on, it doesn't let go. And so we do know it's more contagious, and we think it is also much more lethal.
Oh, that is fascinating. So it's really found a way to be a much stronger virus.
Yes.
Okay. And is this a fad? Is this like, Delta is now and it'll be, 6, 12 weeks and it's going to go away? Or is this around to stay? Is this the new reality with COVID?
I think we're showing already that we get cycles on this. It comes into an area, it lasts for a couple months, and then it kind of fades away. We had really bad in the spring. Some places still had it in the summer. Then we got it again in the winter. Then we had another lull, and now it's back again. I think that's the cycle we're going to see for a little while. We think Delta's bad. The thing that I worry about is Epsilon and Lambda and Zeta and all the other ones that are going to come now, because we didn't get this shut down in the beginning. That was what needed to happen, is we needed to keep it from passing from person to person.
And that really is a great segue to just vaccination. Obviously, vaccination is our number one and most powerful tool. That and masking to contain, vaccination to kind of maybe a more durable population-based outcome.
Yep.
We are in emergency use. I know some people find that troublesome, that this is not fully discovered, this is not fully researched the way our flu vaccine usually is, or our standard pediatric vaccines. Should we be worried that this is emergency? For those that are still worried, some of them told me that they want to wait for the full authorization.
Okay. Well, some of this is a paperwork thing. So the federal government, shuffles papers back and forth. And that probably 90% of the time spent improving vaccines is shuffling papers back and forth. And the reason we got the EUA is because people really they got up, they got done what they needed to do, everybody prioritized it. And it wasn't that they did something different, they just did it more efficiently and faster. The EUA is a little bit, getting off from the EUA and getting to the full authorization though, that took that there needed to be a certain amount of more longer term data. I mean, the original trials were, 2-3 months, but people wanted to see 6 months of data. So that you can't rush. But from I heard on the radio this morning, Tony Fauci thinks that we're going to have full authorization by the end of the month and may even be within the next couple of weeks for at least one of the vaccines.
And that's fantastic. And if that helps convince those that are still on the fence that we have one more stamp of approval, that is a great goal as well.
Yeah, it is.
So now we have a population that is divided, unfortunately.
Yeah.
You and I, as physicians, are 100% endorsing the vaccine.
Yep.
Despite that and copious messaging, a large portion of Americans are unvaccinated.
Yeah.
And that's a reality that we can slowly change. But if I'm vaccinated and I've done my part and I've done all I can, do I need to mask to protect those that have chosen to be unvaccinated from getting ill? Why should I have to mask because of, quote, their hesitancy or their misinformation?
I share your pain on this. I really do. And, we both know a lot of healthcare workers who, in the beginning were sort of the brave healthcare workers and now are feeling really, really frustrated. In the beginning it felt like, this was just this thing that happened to people and there's nothing you could have done. And now everybody is so frustrated and so angry and, we're all right to do that. But what choice do we have? The choice we have is you can either, be mad and not wear a mask, or you can continue to protect yourself. I mean, we all wish we weren't in this place, but, get mad, stamp around, do what you need to do, but then do what you need to do to protect yourself.
Right. And so that brings into the context, what are the times where it's most important to mask? Right now, you and I are having a conversation. Mm-hmm. There's not a large crowd here. We're both vaccinated. I feel comfortable that this is a safe interaction. Mm-hmm. Things are starting to reopen. We have the state fair coming up in 2 weeks. We have concerts and venues opening. For our vaccinated viewers, do they need a mask? What about a vaccine passport to get in? Is that protection enough?
Yeah, a lot of people are doing those vaccine passports. A lot of this comes down to trust. So I trust you. We work together. We both know that we both got vaccine and we trust each other. It's, if you're going to go into a place where you don't have trust with the people that are in that room, then you need to be wearing a mask. It may be, maybe your Uncle Joe, or it may be, 500 strangers at a concert or the state fair. But if you're in a place where you don't trust the people, one is wearing the mask, but the other part is that, they didn't have a fever this morning and were coughing and yet they still came out. We've had that, from the very beginning. So a lot of it comes down to trust. Outdoors is clearly safer than indoors. Indoors, think of it as if you go in a room and you can smell someone's perfume that they were in the room before you. Well, it's the same way with this. The person before you could have been spewing COVID into the air and it's still kind of floating in the air. So you got to think about that. Yeah. So outdoors, though, isn't perfect. So, if you're going to go to a big crowded area with, 50,000 of your, fellow citizens and, crowded right up on top of each other with people coughing and sneezing on each other, then that's not that safe. And, I was so looking forward to the state fair that it's my first time living in Minnesota to be able to go to it. I'm not going to the state fair. And, I had, stopped being that careful with a mask and, I got the mask back on now. Yeah. I'm not happy, but, Yeah.
And we should also acknowledge there are some people that can't get vaccinated. Not very many, but a large portion of those that can't get vaccinated are kids.
Yes.
And kids is a particular area of expertise when it comes to infectious diseases. And kids have a lot of background, and that is your professional expertise. What should we allow our kids to experience? They are, I think, what is the youngest age now for vaccination? Is it?
It's 12.
12, right.
Yes.
So are those kids more at risk, or does it balance out that kids don't get that sick? Is there some balance? Can we bring our children to outdoor events?
So the 12 to 18-year-olds, they're teenagers. And sort of we all know that teenagers aren't totally honest with what they're doing and they want to take risk-taking. So even if your 12 to 18-year-old is vaccinated, you got to kind of keep a little bit closer eye on them because they should be wearing masks. They should be, not up in tight indoor places. And, once they're out of your sight, again, sort of goes back to trust. The kids under 12, we as the adults have the responsibility to try to keep them safe, and part of it is we need to wear masks when we're around groups of kids. We need to not put them in situations where they're going to be at risk. And we need to really, watch them to make sure they're keeping their masks on if they're over 2 years old.
Yeah. And obviously it goes into schools, not just for the children attending schools. A lot of people are teachers in schools and working in schools. And we have a large population of kids that can't be vaccinated or aren't old enough.
Yeah.
We know that we can bring kids out of school with remote learning, but that also has far-reaching consequences, not just educationally, but economically.
Yeah.
It seems like most governments that had initially promoted distance learning are now trying as hard as possible to get our kids back in the classroom. What would your recommendation be for our members that have kids that are hesitant or even worried about sending their kids back to the classroom? How can they keep them the most safe?
But the best way is to open a dialogue with your school. How careful is your school being? Is the school enforcing and really educating parents that if your kid has a fever, or coughing, they shouldn't be coming into school? And how much are they enforcing that? If somebody sees a kid in the school who is coughing or has a fever, that they get sent home and somebody lets the other parents know that the child had that. I do get, it's really tough at this point. In the beginning it was really easy. The kids need to stay home. Now it's, you want to try to get the kids back in school. If your kids are going to a school with an old building with bad ventilation, everybody can wear a mask, but sitting in class all day with just breathing each other's air all day depends on how much COVID is in your community. There's some communities in the U.S. right now that just have lots and lots of COVID. The children's hospitals are filling up, the adult hospitals are filling up. I wouldn't feel that comfortable sending my kid to school in one of those places. But then there's a lot of other places, like here in Minnesota, we don't have as much. And so I would feel pretty comfortable sending my kid to school in Minnesota. But again, keep that dialogue open with the school. Try to give the school, your best advice and see if they're following CDC guidelines.
Yeah. And then last thing, the kid who is told by their parent, you need to wear a mask, and sees the other kids at the same state fair or whatever who's not wearing a mask and they're upset or they're teased. What kind of messaging can we give them on why this is important, and are the other parents bad parents for letting him go on mask? How does, it's hard for a kid to digest why they're different than their peer.
I try to find something, with your, it's all, every parents, slightly differently, but I would try to find some, other example. It comes up in, when they're teenagers. All the other kids, could stay out till whatever time they want, and you want me home at 9 o'clock, It's, it's having that conversation about, I'm trying to keep you safe, and I know you're upset about this. I know that you're not happy. I'm not happy either, but this is what we need to do. Make it all about safety, and then try to put as much control to the kid as possible. Like, what kind of mask do you want to wear?
Right.
Do you want to make a statement with your mask, or do you want a mask that fades into the background? Try to negotiate what can be negotiated with a kid. Try to find places that you can then go with the kid that you don't have to wear a mask, like at a hockey field or something,
right.
And then to give the times. Try to find the places in between where the kid has some control over it.
So I've been vaccinated now. We have my COVID routines. I have a pile of masks at the door at the ready. Mm-hmm. My wallet, keys, phone, mask.
Yep.
It's the new fourth reality
Yep.
of life. It's unclear now. At first, at the grocery store, they said you have to wear a mask, and now it's you can wear a mask. Mm-hmm. When should I, as a vaccinated individual, be wearing a mask?
Well, this is kind of how I think about this, is that I think about COVID is like rain, okay? And you got a raincoat, which is kind of like your mask, and then you got an umbrella, which is kind of like the vaccine. So why would, it depends on kind of how much rain there is out there. Like, you can get away sometimes with just a raincoat, and sometimes you need to bring an umbrella. And I kind of view it that, like, what we had before with COVID was kind of a pretty good storm. And then now we've had just a little bit of sprinkles, so you could get away probably without even wearing a raincoat at all and not get too wet. But now we've got a monsoon, we got a hurricane. And now it is any place where you feel like you're in a place where there's other people might have COVID, then you got to do both. You got to wear a mask and you depend on your vaccine. And to try to do just one doesn't make a lot of sense.
So does that mean that perhaps a vaccine passport or a vaccine requirement, for instance, actually, I believe on the federal level, they made it legal for employers to say that being vaccinated is a requirement for the workplace.
Yeah.
With those types of 100% in here, because you have to show a passport or that was a term of your employment.
Yeah.
Can a vaccinated person feel comfortable being unmasked in that situation?
I think if they're in a place where that they, have a good relationship with their coworkers, like you and I, I trust you, you trust me, we work together. We would, I would expect that you would tell me, like, you need to wear a mask today, and I'm wearing a mask today. So I think the same thing, this is going to have to be negotiated in offices of people saying, okay, we all know that we had vaccine or we wouldn't be here, and we're trusting the other ones not to get one of those fake vaccine cards. So, which I heard that's $400 to get a fake vaccine card, but the vaccine is free. So, like, what kind of a decision is that to make? But, I think it has to be in the situation, especially the workplace situations. You're around the people, there's been some control in this, hopefully employers are being very liberal in that, if you do have the sniffles or that don't come in and, and there's, some liberal policies around that.
Yeah, and for those that are vaccine hesitant, what is some of the messaging I can give them to help them feel more comfortable getting the vaccine? Some of them are citing that they don't trust the vaccine. Some of them as outlandish as that there's a microchip in it. Some of that it's not authorized. Some of them that I have my own immune system, it'll do the work. What is some messaging I can give my family members or uncle or best friend who I want the best for to get that vaccine?
Almost always it means having a dialogue of trying to figure out what it is, where they're coming from. My experience with this, and I've been doing sort of vaccine stuff for a long time, not COVID vaccine, is this because people are scared. I mean, there's like a place deep in our brain that says, don't let a stranger stick you with a sharp object and inject something into you. I mean, it's reasonable to be scared of it. But then, you counter that fear and you go to a good source and try to get information. But I think that back in the beginning of COVID, everybody was it was scary in the beginning. I was scared. And so a lot of people convinced themselves that COVID was not a problem because that was the way you get through the day, especially people that, had to go out in the world. And so those folks are the hardest because they've hardwired themselves now for COVID is not a problem. It's just a hoax or it's whatever. So now how are you going to give them an intervention? So with them, it's just, it's actually been found that connecting them with somebody who already had COVID, who's somebody they're going to trust, again, back to trust, is going to be probably the most effective thing. Some people, they're too busy. Some people, they just haven't gotten around to it. They actually looked at, the people that, are if you put a van to give vaccines out in a neighborhood, people will go just because they're like, well, I didn't know where to go otherwise, type of thing. So it's figuring out what it is they're worried about. There are no bad side effects that we've found so far. That doesn't mean we're not going to find something, but we do know that there's bad side effects to COVID, up and through death. People that recover from COVID, even if they've had a mild case, there's this long COVID that we're starting to understand, that people have long-term parts of it. And I think it's just, we try to help people come up to a risk-benefit decision for themselves.
Yeah. An example I sometimes use is airbags. They
save
countless lives. Once in a while, they may harm somebody, but they've clearly saved countless lives. Seatbelts and airbags.
Yeah. And for the people that talk about liberty, it's my freedom to not do it. I talk about interesting you talk about airbags. I talked about driving down the road. We all agree that we drive down the right side of the road unless we live in the UK. And so, it's not restricting our freedom to not drive down the left side of the road. And we're doing that, part of that, to protect ourselves from, if you try doing that, that's not going to work out so well for you. But you're also doing it because, you're part of sort of the common good of society. And, that's kind of what what this comes to, too. You know, we all in this together, and us not all being in this together has led to Delta.
Yeah. And so vaccines are good. Is there too much of a good thing? People are saying, I want a booster. I want more vaccine. I've heard that boosters can be helpful. Is that a real thing? Is that something for me? What can you tell us about booster shots?
It's a great question. I don't think most people need boosters. The people that need a booster right now are the people that have a problem with their immune system, because they might not have made a good immune response to it. Right now, the problem is that the virus is changing, so the vaccine doesn't match perfectly. Remember I said that virus latches onto your cells? Well, the antibody kind of knocks it off the cells, and it takes a lot more antibody to knock it off the cell now. And you know, the next one might be even more antibody. So right now, what we need probably down the road is a slightly tweaked version of the vaccine so that it covers all those Delta and Epsilon and whatever the other ones are that are coming. So probably a booster is not going to help you or me right now because our immune systems are good and we've probably still got good antibody.
Yeah, so it sounds like it might be something similar to the flu shot where
yes.
If COVID is here to stay, we might just have our tweaked version and we learn to live with it with a vaccination strategy that works for the common good.
Yep, I think that's exactly what's going to happen. So what I want small businesses to know is that they're going to need to a little bit go back to the way it was, but not totally. We've got a vaccinated population, and you know, I was just reading something today that you know, the federal government is making it very easy for small businesses to say, you know, small businesses have the freedom to say who comes in their store and who doesn't come in their store, and so small businesses, especially restaurants and places where you know people are close up into each other, either breathing heavily or without a mask, can say who comes in or not. New York has put in you have to have a vaccine passport to get in a restaurant or a theater. So the question is, what do you do with social media? And you know, I think the natural response of all of us is to go out and look for answers that are going to confirm what we believe already. So if the people who want to say, I think COVID is just a hoax, they're not going to go to the CDC website. They're going to go to all those places on Facebook and Twitter and other places that say, you know, it's a hoax, don't believe them. So, you know, this is a place where you have personal responsibility both for yourself and for the people you're going to expose yourself to go try to get information that is reliable information. You know, even though that's not going to be your inclination and not what you want to do, but it's your responsibility for yourself and for the people around you to try to get the right information. And then, you know, the other thing that people have found is that people that have a good relationship with their primary care provider, whether it's a nurse practitioner, doctor, you know, whomever, that, you know, that they are much more likely to get vaccinated because they can then, you know, write down your questions and then, you know, hopefully you're going to this provider because you trust them and then find out what they have to say. I don't think we're going to close down again. I don't think that we're in that place. I think that there are going to be regions where things are going to close down just because it's so overwhelmingly, you know, so much COVID. I mean, I really worry about places like Florida and Arkansas and Texas that it's, you know, very low number of people that are vaccinated and it's just spreading like crazy. The hospitals are filling up. And I think that just by necessity that there's gonna be local closures in places like that. I don't think we're gonna have closures in other places, and especially in areas where people, you know, are generally well vaccinated. I think you're gonna have things that get limited and, you know, we'll wear masks and then we won't wear masks and there'll be crowd size limitations and then there won't. And hopefully we'll put in better ventilation in our schools. Things like that, but I don't think we're going to have the kind of close downs that we had last year. Hope not.
I think it's also important to, as we look at this next Delta wave, that we know so much more now at the beginning of the Delta wave than we did at the beginning of COVID-19, novel coronavirus.
Yes.
What do we know now that we didn't know at the beginning that's helping us make better decisions?
Well, you know, all the stuff we've been talking about all along. We know that we have a vaccine. We know that masks help. You can argue about which kind of mask is a better mask and how many and all that, but we know the masks make a difference. You know, hospitals and doctors have gotten a lot better at taking care of the really severe COVID. So as long as you're not flooding the hospital with too many patients for them to handle, people have gotten pretty good and the survival rates are getting a lot better. I think that, the thing that worries me that we don't know is that it seems like Delta is affecting children more than it did the other versions. And I don't know whether it's just because there's so much Delta that everybody's getting affected, so you got a lot of kids that are sick, but it does appear that children might be more affected. A lot of people say, oh, kids don't have a problem, but there are about 3,000 children that died from COVID from, the first couple of waves. And, I think if you said, 3,000 children died because of, a bad pill that they were given, that people will be up in arms, and people are just saying, well, only 3,000 children died. And, that just shows kind of how we've changed our perception of things.